Are you a registered nurse that's planning on taking your NCLEX-RN exam? And like every other nurse that's taking the exam, you are in that position where you have the burden to know each and everything in your exam. In this video, I'm going to tell you that it is okay not to know each and everything in your exam. In fact, it is also very normal not to know everything. So without wasting any time, let's dive right in. Hello friends and family, welcome back to another video. So in this video, we will be talking about how it is extremely normal not to know everything in your exam. And in this video, I'm also going to discuss the strategies that you can use to take your NCLEX-RN exam without knowing each and everything related to nursing. And if you're new to this channel and are in your journey to either take your NCLEX-RN exam or are in nursing school, I'm Karen Zedwin, and I've been a registered nurse in the United States for about 6 years now. And on this channel, I'm helping aspiring registered nurses, mostly from Pakistan and other international countries, get through their NCLEX-RN journey like a boss. So in this video, first of all, I want to acknowledge something. The NCLEX-RN exam is not designed for you to know each and everything about nursing, but it is designed to make sure that you're a safe nurse and you are capable of making effective decisions in the clinical settings. The goal for this exam is not for you to recall each and everything you've studied in nursing school, but the goal is how you critically think and handle different scenarios that could occur in a hospital setting. So it is perfectly fine that you do not know the entire syllabus or your entire educational material that you studied in nursing school to answer every question right away. But what matters is your approach of how you attempt these questions. So in the next few minutes, I'm going to explain this a little further so that you have a clear understanding of what I mean by what I'm saying. One of the main strategies that this exam focuses is called Computer Adaptive Testing, or CAT. This means that the more efficiently you're answering these questions, the harder it's going to get for you. So for example, you answer 5 questions in a row that are right, it's going to just keep getting harder and harder. And as soon as you get a question wrong, the next question is going to get easier. This is a testing method that is used to test your competency instead of tricking you into answering something wrong. It just wants to see how good you are at attempting these questions and what your approach is, not to fail you or make it harder for you so that you're not able to pass this exam. And also, here's the thing about all these questions. It's not just about you getting these questions right or wrong. It's just about how you think about it and what's your approach to a certain scenario. While taking your exam, you're going to see a lot of the select all that apply questions. And while going through the options, you're going to think all the answers to the questions are right. And it gets very hard for you to choose which is right and which is wrong, or which options to eliminate. There are also going to be scenarios to which you might think that you know the answers for the most part, but you are not totally sure about all the details. But guess what? That is totally normal. If you ask me, or if you ask any other person that has passed their NCLEX-RN exam, they're going to tell you they went through the same scenario. No matter how hard you study, no matter for how many days you study, you are going to struggle in this test just because of the way it's designed. Once again, the main reason for this exam is to see how competent you are with taking care of multiple scenarios and how safe you are, instead of you knowing each and everything that you learned through the nursing school. It is not about getting everything perfect. It's about showing your ability to think critically and make the best choice in the given scenario. Another thing I want to stress on is it's okay to not know all the drugs and all the procedures that you've learned in the nursing school. But what you can do is think through the scenario logically. You always have your nursing process in your back pocket, which is assessment, diagnosis, planning, implementation, and evaluation. So if you don't know what to do for a specific question, use the process of elimination. Focus on what's safest for the patient and consider what would have the most immediate impact on the patient. Most of the time, it's not about knowing the specific answer, but rather about you showing your reasoning for the specific answer. Here's something else that I wish I knew before I took my NCLEX-RN exam. You are not supposed to be perfect before taking your exam or while you're taking your exam. The NCLEX is not a pass or fail exam. It's taken so that you can demonstrate that you are a safe nurse and you know how to act in certain scenarios, and not that you know every detail or every drug, procedure, or system. The key to this exam is not knowing everything, but the key is to think like a nurse, how you can prioritize and eliminate the wrong answers. It's about how you can handle a certain situation with the knowledge that you have. And trust me, once you start thinking like this, it's going to be a huge relief for you. And it will also help you with your learning when you are taking your NCLEX-RN exam. So here's you can approach a question when you are unsure of the answers. The first thing you want to do is do not panic. There are going to be questions that you don't know the answer from, but if you start panicking, that's going to impact the questions that you're going to take after this. So if this happens to you, just pause for a second and think about what you do know in this question rather than the things that you do not know. The first thing you're going to do is start eliminating the answers that do not make sense to you. Ask yourself, what's the safest option? What would you do that's going to immediately impact the patient? What will be the greatest benefit for this patient? Once again, you are not expected to know everything, but you are expected to think critically. And guess what? If you get an answer wrong, it's not the end of the world. You still have a lot more chances that you can take in this exam and pass with flying colors. The NCLEX is not about being perfect. It's about showing that you are a safe nurse and you can make informed decisions in certain scenarios. If you get a question wrong, don't beat yourself up. Instead, think of why you got it wrong and learn from it. Maybe you just need to brush up on certain topics, or maybe it's just a reminder that you need to start trusting your instincts. Mistakes in this exam or while you're preparing for this exam can help you grow, so don't start thinking that you do not know anything. Especially when you're doing practice questions, there are a lot of questions that are going to be wrong when you're answering them, but you have to learn from these questions. So in summary, it's completely okay not to know everything in your exam. The exam is designed to see your critical thinking, your decision-making skills, and your immediate response to a specific situation. So trust your knowledge, use your nursing judgment, and don't let some of these tricky questions throw you off. The goal is to demonstrate that you are a safe and an effective nurse and you are capable of making informed decisions. And you absolutely can do that without knowing everything in this exam. I hope this video helped you. And if you think anybody's in the journey of taking their NCLEX-RN exam, make sure you share this video with them. And don't forget to subscribe to the channel for more nursing related content. And if you need more tips and tricks for this exam. And if you have any more questions or you want me to make videos on certain topics, don't forget to leave those in the comment sections and I will try my best to get to those videos as soon as I can. I hope you like this video and I'll see you in the next one. Thank you.